All right, guys, welcome to How to Be a Standout Medical School Applicant. We are so excited to have you today. Let me just tell you who's part of the team today. We have, speaking of standouts, we have the A+ team today, basically. We have Dr. Blair Nelson, who is one of our most esteemed and, just dearest advisors with us, basically. And behind the scenes, we have our Director of Marketing, Brett Rudy, and he's there too. He's going to be helping us deal with all the questions that you might have. And we really hope that you have a lot of questions basically for us. So he might pitch them to us during the presentation and even afterwards. We're going to try to save the last 15 to 20 minutes of our session today to answer all of your questions. So you've got a lot of people on hand to hopefully provide great advice for you. So we strongly encourage you to ask us a lot of questions, basically. So in terms of getting started, before we go on, I want to tell you one thing. When you see the term standout medical school applicant, I want you guys to remember that there are actually two components to this in terms of being a standout applicant. One is in terms of optimizing your candidacy as an applicant, and that's the part where you're optimizing your grades, your MCAT, all the extracurriculars that you're doing. That's like the foundation, basically. And then closely related to that, which we also are experts in, is optimizing the presentation of your candidacy. And that's the part with the personal statement, the letters of recommendation, the secondaries, and the interview. So I want you guys just to keep that in mind as we talk today. Next slide, please.
All right.
All right. Well, this is just more about me and Dr. Nelson, basically. You can have a closer view of all the white hair in my head. I think that's one of the side effects of going through pre-med and becoming a physician. Well, I wasn't going to say anything like that, but all right. So we each have our own, hair issues, basically. But, in all seriousness, what is listed here in terms of our brief resume is to show that, we're qualified to be talking to you guys today, basically. So that's so you can know a little bit about us, basically. I'm one of the associate directors of advising, and I'm going to call him Blair because we're colleagues. I'm going to forget, but Blair is one of the master advisors, and like I mentioned before, one of sort of the most beloved advisors, basically.
Thank you.
So you're in good hands with us today. So why don't we get started on the next slide? All right, so, in order to be a standout applicant, I would argue one of the things that you need to know as fundamental knowledge is the ways that you can become a physician and the types of medical schools that are out there. So Blair, maybe you could tell us a little bit about each of these for those who might not know, basically.
You bet. So, when I applied to medical school back in 1991, which is more than 30 years ago, which is terrifying because it seems like yesterday I was going through this. Although none of this was, centralized, it was all paper. But, I didn't even know what osteopathic medicine was. Over the last couple decades, osteopathic medicine has definitely become, more prominent, more well-known. So kind of to differentiate the two, allopathic medicine is what we consider kind of the traditional MD track, what most people consider what medical school is. Osteopathic medical school kind of generated more from like the chiropractic approach, where they use some osteopathic manipulative treatment, which is similar to some chiropractic adjustments. But there's been kind of a meld of the two, because allopathic medicine, MD medicine, has been more and more recognizing some of the non-traditional treatment paths, acupuncture, some of the natural medications and so forth. So there's been a drift of allopathic medicine towards that aspect. And then osteopathic medicine has also kind of drifted more towards allopathic medicine, in understanding that some students ultimately will want to go towards more of an allopathic residency training. So in the end, your end game can be the same. It's really depending upon where you do your residency training after medical school. However, coming out of osteopathic medical school does make it more challenging to obtain an allopathic residency program in some of the more competitive specialties, such as dermatology, orthopedic surgery, ENT surgery, and so forth. However, if your kind of end goal is to work in primary care medicine, going the osteopathic medical school route is a viable option to get to the same end game. Osteopathic medical schools are a little bit easier to matriculate into as far as, allowing lower grade point averages, lower MCAT scores as far as their averages of matriculation. But that said, they also know that a lot of students use them as kind of a backup plan.
Mhm.
So in order to be a viable applicant to osteopathic schools as well, I tell all my students, you need to get some osteopathic experience by, working around or shadowing an osteopathic physician in order to get a letter of recommendation from an osteopathic physician if you're going to apply to those schools, because that really seems to be their litmus test of, is this being used as a backup plan, or is this somebody that's truly interested in osteopathic medicine?
Yes, absolutely. And to sort of piggyback off that, there are some osteopathic medical schools out there now that do require a letter of recommendation from a DO physician, though. So that's something you want to keep in mind. And also to sort of to continue this part, it's not a walk in the park to get into DO school. Sometimes there is that misconception about it, basically. And if anything, similar, I'm going to show you some statistics in a minute, but similar for allopathic medical schools, it also got more competitive to get into osteopathic medical schools. And I would strongly encourage you guys to sort of check it out. Look at the AACOMAS website, read the principles of osteopathic medical schools. I actually think it's a set of principles that should be applied to all of medicine, because it's patient-centered, it's about, holistic treatment, it's about prevention. I mean, like all the good things that we hear often in allopathic medical schools too. So I think that's just something to keep in mind. Basically, it's a wonderful other way to go to medical school. So something you guys should keep in mind, basically. Can I have the next slide, please? So I was just talking about statistics, a little briefly before. So let's give you guys an overview here. So I was looking at the latest stats here. You can read this, but average GPA. So this is more for MD schools, just so you know. 3.75 for the total. Average MCAT almost 512, basically. So I want to tell you, I brought these statistics for a few reasons. So number one, it's very competitive to get in. Prior to the pandemic, the number of applicants per year applying to like MD schools was about, around 50,000, I would say, a little bit over, maybe 52 to 53,000. And about, 43% were getting in every year, basically. And that was already competitive as it was, basically. Then the pandemic hit, and I actually thought the number of applications were going to go down, and I was completely wrong. They actually skyrocketed. It turns out we have a lot of wonderful humanitarians out there who really want to help people. So great for us, bad for if you're a med school applicant, basically. So it went up by about 17%, actually, and you can see about 62,443 applicants. And at that point, the percentage of people getting in each year dropped to about 37%. And then since then, it's leveled a little bit off. It's gone down a little bit to about 55,000, but it's still higher than the pre-pandemic levels, basically. And so that means, I would say at this point, about only 40% of applicants are getting in every year. And then in terms of medical schools themselves, like MD schools, the acceptance rate is in about, it's in the single digits. And this is not only for the quote unquote top tier med schools like the Harvards and the Hopkins of the world. First of all, there's no such thing as a safety medical school, okay? Put that notion aside. It's single digits for almost every type of medical school out there, basically. So that's something to keep in mind. And one of the other reasons that I put these statistics up here is because, and I can imagine Blair gets asked this question at times too. I often get asked, I sometimes get asked by clients, so, which part of my application do I need to optimize? Is it the grades? Is it the MCAT? Is it the experiences? And I say, you know what? You need to optimize everything. There's given how competitive it is and how, there's just barely any difference between applicants these days. You don't have room to choose, basically. You really need to try to optimize every part. And, even for people who optimize every part, I've, unfortunately had some clients, even with the 4.0 GPA, great MCAT, all that, who, get waitlisted, who don't even get in sometimes, basically. I'm not saying this is the rule, but nothing is a guarantee in terms of that. So that's why, we're having this lecture, this talk today about how to optimize all the parts. Blair, do you have anything to add to this?
Yeah, I would just say that, if these numbers look a little disappointing, it could be worse. If you live in Canada, the matriculation rate into Canadian medical schools as a Canadian applicant is between 2 and 3%. So, and that's just based purely on the fact that there's not many medical schools in Canada. So, these aren't great statistics, but they are definitely better than other situations.
So that's one way of looking at it. All right. So Blair, I think this is your domain here, right? In terms of the medical expectations.
So when it comes to your application, there are, parts of your application where you're going to try to individualize and kind of make it your own and kind of tell your story. But there are also parts of the application that are kind of things that are prerequisites, things that everyone needs to check the box. Everyone needs to kind of have a part of and excel in, as far as, like, Dr. Ziggy was saying, is you can't really have a slack area of your application. When it comes to some of the prerequisite stuff, as far as courses, there are some nuanced differences from school to school of what prerequisites they require. But I look at it in this approach. I break prerequisites into two categories. One is what I call core prerequisites, another I call non-core prerequisites.
Mm-hmm.
The core prerequisites being courses that you need to take in order to be eligible to apply to most medical schools. The non-core prerequisites are kind of the nuanced differences, the ones that you don't really need those to apply to the medical school, but you definitely need to have them completed before you start medical school there. So the core prerequisites, the ones that you need to have completed to apply to most medical schools, are a year of the following courses with labs: biology, general chemistry, organic, and physics. And then 1 semester of these courses: English writing, you need statistics, some sort of math. Luckily, it doesn't need to be calculus. Could be algebra, is fine. And then psychology. And that's also the material that's on the MCAT. So it kind of core prereqs match up with the material on the MCAT. Now, addition to your prerequisites, there's also some what we call extracurriculars that medical schools are looking for as far as being on your application as well. They want you to have put yourself out into the world, out of your dorm room, gaining skills and aptitudes that will help you succeed as a medical student. And we break these extracurriculars into several categories. We break them into clinical experience or clinical work, shadowing, and the difference between those two: shadowing is you're a fly on the wall watching physicians. Clinical work or clinical experience, you're interfacing with patients. Research, we recommend about a year of research, getting that exposure to how research is done. And then community service, getting out into the community, realizing some disparities that exist in certain communities, certain factions of your community that are different than others. And then I would add one category to this extracurricular list, and that is leadership.
Mm-hmm.
I think that's one that's really misunderstood a lot by students. They equate leadership with a title. I have students say all the time, well, I have plenty of leadership. I was the secretary of the physics club and vice president of the pre-med club. And I'm like, well, what did you do in those positions? And they're like, well, not much. We didn't meet very often. Right. That's not leadership. That's a title. Leadership is basically taking on more responsibility than what was expected. I mean, you could be the manager of Dairy Queen, or not the manager, but just work at Dairy Queen and have to close every Thursday night. That's leadership, even though you're not designated a manager. Also, you need to take the MCAT and score well on the MCAT. I mean, if you look at the MCAT, it's already a skewed population of who takes that test because it's a bunch of smart people sitting for that exam. The mean of everyone who takes the MCAT is 500, that score. But the mean of those who get acceptance to MD school, allopathic school, is 512, which is around the 85th percentile. So you need to do well on that MCAT to be a viable candidate for MD, and now osteopathic school. And then there's some other ethics exams that are newer to this process, which are called Casper, and the AAMC Preview, which is a newer, similar ethics test as Casper. Some schools are requiring instead of Casper just for political reasons, but all schools require some sort of ethics exam as well.
Great. I just wanted to add a few extra things to this really great information that Blair gave. So in terms of the extracurriculars, for the clinical work, there's a few different ways that you can obtain clinical experience. I would say the most common way that everyone and their mom does is volunteering at a hospital, basically. And there's nothing wrong with that, basically. You know, this is where you're transporting patients, greeting patients, bringing blankets, and that's really good. One of the sort of quote, downsides of that, like as I just said, is like so many people do it, so it's a little harder to differentiate yourself. So some other ways that you can get clinical experience are as follows. You can do scribing, you can do EMT, you can be a hospice volunteer, and you can sort of kill two birds with one stone if you do clinical research, because you'll be getting clinical experience and you'll be doing research. Shadowing, Blair already defined that, so that speaks for itself. Research, as he said, try to do at least 1 year. If you can try to get publications and presentations, that's always a good thing to do. And then in terms of community service, that can be both healthcare and non-healthcare related. I've had clients who do Habitat for Humanity, volunteer in a food kitchen, things like that. Those are all so you're giving of your time without getting anything in back in terms of compensation and things like that. And I'll also add another category beyond leadership to what Blair wrote, even though I'm the one who did this slide, so I probably forgot this part. But I would say hobbies is another thing as an extracurricular, basically. That's one of the few areas where you often start it prior to college. And so if you've started it prior to college, I have a lot of, I'm sure Blair and I have clients who have these amazing extracurriculars like chess master, violin, gymnast. I mean, one of mine is a professional figure skater. I can barely touch my toes without, a pair of chopsticks. So anyway, so whole different league there, basically. So, we have, keep in mind the hobbies. It doesn't mean you have to start a brand new hobby in college just to put it on there, but people often forget about it. So that's just something to keep in mind. All right, next slide, please. All right, so one of the most, I would say for me personally, I think in terms of being a standout applicant, I would say by first and foremost, branding is the most important thing. This is people use different terms, story, narrative, whatever. I like to use the term branding, but this is, when I meet with my freshman and sophomore clients, basically, this is the first thing I talk about is the importance of branding. I would say it's the most important thing to do, but unfortunately, it's the thing that almost nobody ever does, basically. And what is branding, basically? This is sort of the evidence-based narrative that you create based on your extracurriculars and your courses throughout college, so that by the time you apply to medical school, it's really obvious, you're able to differentiate yourself and really talk in a granular way about why you're so passionate about medicine. And this takes a few years. This is why you have to start it as soon as you step on campus, basically, because you don't want to do this retroactive fitting by the time you're applying, which is what a lot of people do, basically. And at least for me, and Blair might have other ways, at least when I talk to my clients, I say there are at least 4 ways that you can brand yourself. One, the most obvious way is based on specialty. So I have clients who say like, oh, I want to be an oncologist. I want to be a pediatrician. I want to be a psychiatrist. So of course I like them more. But those are a few ways. I think it's fair to say that most people, by the time that they apply to medical school, and even when they start medical school, do not know what they want to specialize in. And that's perfectly fine, perfectly natural. In fact, it's good to cast the net wide and figure out what you want to do. So for those of you who don't know what you want to do, there are at least 3 other ways that you can brand yourself. A second way could be based on demographic. And so I have clients who often say, oh, I'm really passionate about, working with underserved populations or immigrant populations. Now, some demographics like children lend themselves immediately to a specialty like pediatrics. So demographic could be another thing you could think about. A third way that you could consider branding yourself is based on an approach to medicine. And at least for my clients, I usually see this most often with undergrads who are majoring in public health, because not surprisingly, they want to integrate that approach as future physicians. So that's a big part of their career goals. But it could be based on preventive medicine. It could be based on personalized medicine. Blair, you're emergency room, so I guess that's reactive medicine. If you're passionate about that, basically, So that's another way. And then the fourth potential way could be if you are passionate about an issue related to healthcare. So I briefly had a client once who was very passionate about medical technology. And if you looked at her resume, it made complete sense because she worked for a medical device company and did all of this stuff related to medical technology. It could be advocacy, it could be, different things. So I would start thinking about what your brand is as soon as possible. And I'm going to skip to this part where it says, how do you figure it out? Start thinking at a granular level. Not only why are you interested in medicine, but why are you passionate about becoming a physician specifically? And also, how do you imagine yourself practicing as a physician later on? Do you see yourself in an academic setting, private practice, rural, urban? It's kind of fun to fantasize about how you're going to be a physician later, especially since you're going to be investing the next, 8 to 12 years of your life doing this. So I think that's a good thing to do. The reason it's so important at a more granular level, as you see, I wrote extracurriculars and personal statement here, is if you figure it out early enough, ideally freshman, sophomore year, you can start strategizing your extracurriculars, which is a great way to go. So to use a very simplistic example, if you decide, I want to work with children later, I want to be a pediatrician. So that's great. So that means, well, maybe in terms of scribing and or shadowing, you find a pediatrician, right? In terms of research, you find a common, a disease that's prevalent among children and do research for that, right? And then in terms of community service, well, maybe that means that you want to volunteer at an underserved elementary school and tutor there, right? So that means you're strategically picking these extracurriculars versus sort of, willy-nilly basically. And that's going to look better for you later on. And then in terms of a personal statement, at least in terms of how I work with my clients, I always tell them once they figure out their brand, they essentially have the thesis sentence and the theme for their personal statement later on. And so that's why, that's why this branding serves as the foundation. All the stuff that follows after that is like the framework for the house and the roofing. Anything you want to add, Blair, in terms of the branding?
That was perfect. That was perfect. But it leads into what we're going to talk about next, which is optimizing extracurricular activities, which is exactly what Dr. Ziggy was talking about. Is okay, if you kind of have this overall theme or brand or narrative that you have for your potential future application, then you kind of optimize your extracurriculars for that. Now, things that I run into with some of my pre-med coach clients, which are students that we're working with as freshmen or sophomore, or variably other situations, is you can't fit everything into the brand. There's the things that you're kind of just doing because you need to show those prerequisites, show that you've obtained those experiences and skills, but not everything is going to fit under the brand. So I see a lot of anxiety in some students going, well, I need to do something in this category, but I don't know how I can fit that into my brand. And I'm like, well, not everything is going to fit under. That is just an overall kind of narrative or tone to your application. But do it is best for that particular category. Now, when we talk about optimizing extracurricular activities, what I think about in this situation is, doing something that has some connection to what is in your DNA versus just doing something to check a box. So looking at clinical experience, for example, I'm a big proponent of recommending hospice volunteering for my students, because you're not going there just to kind of check the box that I was there, I spent so many hours there. You're going there to have an experience. You're going to take something away that you can translate onto your application and communicate to the admissions committees that you obtain some significant skills and experience from putting time into that, not that you just put the time into it. So when you're optimizing experiences, you're trying to pick experiences that, if it fits with your brand, But if it doesn't fit with your brand, at least it's something that you're not just going there to do just to check the box. You're going there to gain something from the experience. I tell my students, there's a why behind each category. There's a why. There's a reason admissions committees want to see these things. The why behind clinical experience is so you get adept at interfacing with patients. Now that sounds silly because patients are just people, but yes, they're not always easy to interface with. They might have dementia. They might be intoxicated. They might have a head injury and so forth. So they're not always so simple just to communicate with or connect with. Also, when you're choosing experiences, it looks better on an application to have something that you've committed to long term that you can potentially kind of advance in as far as a leader in, instead of a hodgepodge of random short sprints of things. And that brings up another point. These extracurricular categories are not mutually exclusive. So if you go into a volunteer experience, commit to it long term, you could potentially gain some leadership as well. So like Dr. Ziggy said, you're killing two birds with one stone, and that's part of the growth of it, growth into the leadership. And then the results aspect of are, okay, this is what I got out of it. This is what I can translate onto my application. And that I'm going to resonate back to what Dr. Ziggy said at the beginning is, it's one thing to gather all these experiences. It's the second half of the job of then translating them well onto the application.
Exactly. And just one thing I was thinking about as I saw optimizing extracurriculars, I thought of it because one of my clients actually asked me this today, was that, do I need to pick an extracurricular activity that's unique in the sense that like nobody else has done it before? This is like a common misconception, basically, because you see the word unique and that's kind of a vague term. And of course we think from a statistical term of like 1 in a million. And I always say, no, that's not the point of what makes you unique, basically. It kind of goes back to what Dr. Blair said about picking what you're passionate about and then really optimizing it, basically. Now, if you just happen to pick, if you organically pick something that nobody else is doing, then, well, that's more power to you. But I wouldn't purposely look for something that nobody else has done. I think that's going to lead to other problems of picking things that you don't like or something. There's just a whole host of other things that can go wrong. And then the last thing I just wanted to touch upon as I was looking at that thing about results is, that's really something to keep track of. I don't know about Dr. Blair, but I noticed when I review sort of the work activity section for a lot of my clients, one of the things that I noticed that's often missing is that they're not quantifying or qualifying results whenever they can. They just sort of make vague thing, they talk about their responsibilities, what they learn, but I don't really see the impact that they're making. And these are often for extracurriculars where you can actually write about the impact that you're making. So that's probably one of the most common feedback that I give often is, hey, can you quantify or qualify your results? If you, for example, if you were the fundraising chair for an organization, literally write down how much you raised one year and how much you raised the next year. And if it went up, talk about what you did to get that extra money, basically. Maybe you came up with a new marketing campaign. Maybe you forged new relationships. But by explaining what you did to get more money, you're inherently marketing more proactive skills and qualities about yourself. All right. Oh, letters of recommendation. Yes, very, very important. So one of the first things you guys need to figure out, especially if you're at the university, is, do you have a committee letter or not? A lot of times I talk to clients and they're like, what are you talking about? So you need to, go to your pre-med advisor. Sometimes they're given a hard time about that, but take advantage of pre-med advisor, go to them and ask, do you have a committee letter or not? A committee letter is an evaluative letter written about you by, as the term says, committee. So you want to know if you have that. And med schools, if they know that your university offers a committee letter, they are going to expect to see a committee letter from you. If you don't have one, they're going to wonder why you didn't get it, basically. So it's like a decision tree model, committee letter or not. If you have a committee letter, ask what you need to do to get that committee, to get the committee letter, because it varies between universities. Sometimes you have to fill out a whole application. Sometimes you have to do interviews. Sometimes you have to do some combination of that. And if they don't offer a committee letter, ask them, okay, so what do pre-meds at our university need to do to get letters of evaluation, basically? This is very important. And this is something you should strategize actually a few years in advance, quite frankly. I know most people just sort of think about it a few months before they're applying, but this is something you should think about ahead of time. Let's say, for argument's sake, that there's no committee letter. What is sort of the utopian mixture of letters that you should be getting that'll satisfy most medical schools? So this is what it is. You want to get 2 from a science professor, 1 from a non-science professor, and then sort of 2 outside of academia. It could be from a PI for research. It could be a doctor that you're shadowing. It could be a supervisor for, an extracurricular. But it is something you want to start thinking about ahead of time, because you really want to make sure that you can optimize it, basically. And of course, the best ways to get letters, especially in terms of professors and in terms of your professors, is get a good grade. That's like step 1, basically. But the other thing is you should try to cultivate relationships. I don't know about Dr. Blair, but I know the most common problem I often see among my clients are people who are non-science majors who then struggle to find letters from science professors because, of course, they say, oh, the classes were so big, I wasn't able to, connect with them in any way. They don't know me from a hill of beans, basically. And that is tough, basically. So if you are in that situation of maybe being a non-science major and struggling to find, you think you're going to struggle to find getting letters from a science professors, I recommend doing a few things. Number 1, of course, get a good grade. Number 2, take advantage of office hours, but don't just drop in and shoot the breeze. You need to come with really good questions to ask, basically, and that you really care about, because professors can smell phony baloney from a mile away, basically. So you don't want to do that. And then number 3, if there are review sessions for any exams, midterms, finals, I would take advantage of that, basically. Even if you know the material, it's good to show that you're interested. It's good to show that you're motivated. And quite frankly, another tip is sometimes when you go to these review sessions, the professors or TAs give you little hints about the test because you actually took the time to show up, basically. And then if you have an opportunity to be a TA for a class, I think that's a great thing to do too, because then they're able to comment about you from another perspective, not just from being a student in the class, but from someone, from more of a leadership position, basically. And then the last tip I want to give is, this is going to sound a little strange. Oh no, this is the second to last tip I want to give. When you reach out to a prospective letter writer, I'm going to assume that you do it through email, basically. What I recommend to my clients is, in the message, in the body of your email, ask them if they would feel comfortable writing a strong letter of recommendation. Now, I actually say you literally write the word strong, because there are some people out there that agree to write a letter and then they don't write a strong letter of recommendation. I don't understand the rationale behind that. I think it's unethical. I've had people ask me to write letters, and when I felt like I couldn't write them a 10 out of 10 letter, I said no, basically, because I didn't want to sink their candidacy, but I wanted to be honest on the other hand, basically. So at least that's a way to ensure that you're going to get a good letter. So I think that's very important. Dr. Blair, any thoughts on letters?
Yeah, so a big thing that I run into is, students will say, well, my class size was 500, how do I even get a letter from that person? And, these professor letters are really only going to talk about your academic aptitude. They're not going to be like your greatest letters. They're not going to be talking about, your approach to clinical care or anything like that. They're just going to be, talking about your ability to survive academically. So you don't need this profound relationship with the professor. Like Dr. Ziggy said, show up to class, engage in class, go to office hours, go to review sessions. If you did well in the class, the professors know the game. They know that this is part of their kind of world, part of their job. I teach, so I write letters of recommendation all the time. And it's not that I have to know this person's family or, their mom's maiden name. I just need to, give a sense of how they did in the class. And I'll give an example. I asked I still remember this, and it was, early 90s. I asked my organic chemistry professor for a letter of recommendation. I had that professor for an entire year. I went into his office at the end of the year and asked for the letter of recommendation. And he goes, "Who the hell are you?" And I said, you know, I'm in your class. Oh, he's like, oh, Nelson, I didn't recognize you without your hat and glasses on, because it was at 8 a.m. lecture. I got up at 7:55 because I was 19 years old, put my hat on and my glasses and went to class. So once he realized who I was, he's like, oh yeah, you know, you did well. I'm happy to write your letter. So you don't need to know, you know, these people super well, as long as you did well and put effort into their class.
Absolutely. All right. Next slide, please. I think we have about, I'm shamelessly looking at the clock. It's 8:36. We have about 4 to 6 minutes left, so we can go through these last few slides. Dr. Blair, do you mind doing this
Sure.
the last two slides, this slide and the next one, actually?
You bet. So, you know, commonly asked questions, I'm going to kind of skip over pretty quickly because I'd rather get to the questions that you guys have that are on this call today. So, but one of the questions that really comes up, you know, a lot is about AP credit. So I want to address that, and we'll go to your guys' questions. Medical schools, for whatever reason, do not recognize AP credits as, you know, credits for the prerequisite courses. So those core prerequisites, the ones I outlined earlier, if you have received AP credits for those, repeat the course in college. They want to see you take that course at a college level. They will not accept it, especially some of the top tier schools will not accept AP credits for those core prerequisites. So that's the only one I'm going to really address. We'll get to your guys' questions. And the last slide. So I've had the pleasure of working with Dr. Ziggy in this program that you created, Dr. Ziggy, called Pre-Med Coach. And I love it because, you know, in working with tons of students over the years on helping them with their application, I felt horrible when the student would be like, oh, I wish I would have known that, or I wish I would have done that. So smartly, Dr. Ziggy created Pre-Med Coach, where we're working with students at the freshman, sophomore level, you know, basically the year or two before that application cycle year, where we're working directly with you on your application to build your application going forward, working on all these things like branding and so forth, and making a strong application instead of looking at retrospectively at your application with tears in our eyes. So the Coach program is unique in the fact that, you know, you're assigned one of us as your advisor. You meet with us once a month. You have outside access to us outside of those meetings. You know, if you need to ask us a question via email or message us, you have access to us between those meetings to you know, to bounce things off of us. We plan coursework. We plan your timeline for MCAT. We organize your MCAT studying timeline. We balance your extracurriculars. We help with branding and so forth. So the Pre-Med Coach program has really taken off like gangbusters over the last year. I mean, it's just really caught fire. People have really realized the benefit of, you know, kind of engaging with this, you know, mentoring process. And, you know, sadly, this wouldn't exist. This company wouldn't exist if this guidance was done well at the collegiate level. But unfortunately, at the collegiate level, a lot of this mentoring is done by PhDs who haven't gone through this process and don't know kind of the nuances. And it's not their fault. It's just that if you haven't been through it, you don't realize some of the kind of unique hurdles and steps that come inherent into applying to medical school.
Absolutely. Yes. Thank you. So we're going to call back our awesome director of marketing to handle the last two slides. We're going to pull back the curtain. Brett, are you there?
Yeah, I'm here. Hey, so great job. So the first thing I was going to say is we're going to be doing Q&A momentarily. And if any of your questions do not get answered, and I'll probably regret saying this too, because there's 400 of you on the call, but email me personally, and I will assure you get a response. And I'm going to post my email. Hold on right now. I just posted my email address in the chat. So we're going to get to as many of these questions as we can in the next 20 minutes. But one of the things that I wanted to tell you about Med School Coach is that all we do is help students get into med school. We have more than 80 physicians who have served on admissions committees, and all we do is help students at every single step of the admissions process, from completing their applications to application support to doing mock interviews, to editing their personal statements, secondary essays. We really help students at every step of the way. And if any of you are in a position where you feel that that's something that you want to do, you can speak with one of our enrollment advisors, and they will pair you directly with the physician that matches to your background. So we have a QR code on the screen that will allow you to schedule a meeting if that's something that you want to do, or otherwise you can email us at info@medschoolcoach.com. Our address is there, and as I mentioned, I put my personal email address in the chat on the side. Ziggy, can you go to the next page?
Oh,
So I guess that's it. So back up a page, because we don't want people to be staring at that the next 20 minutes. So they better to look here for the next 20 minutes. So
Okay.
we have currently more than 100 questions opened. The one thing that I'll say is, again, if there's anything that we don't get to, email me. I will get back to everybody individually. But
That's
what I
great.
want to try to do with both Dr. Nelson and Dr. Ziggy is get to as many of these as we can. And I found some commonalities in the questions. So I'm going to throw these out there, and I'm going to let the two physicians fight over who gets to answer them. But we've had a lot of questions about hours. So let me ask the full question, then you can jump into this. How many hours of community service do I need? How many hours of research do I need? How many hours of shadowing do I need? Some people have said, is this even required? Do I need any hours of shadowing? What if I don't have any hours of research? And then, of course, tied to that, and then how do I get that experience? How do I get the research experience? How do I get the community service experience? How do I get the shadowing experience? So I realize I just asked you like 9 questions in one, but if one of you could sort of tackle the, where do I need the hours? How do I get the hours I need?
Yeah,
What can I get
we
away
got
with?
it.
You got
All
this.
right. Blair, do you want to do the hours part, and
Sure.
I'll do the how do you actually get
Yeah,
these
I'm
hours?
happy to do that. So this
Okay.
company does a great job of keeping kind of track of a lot of data points, and we meet and disseminate that information to all the advisors and so forth. So this is pretty common knowledge. So as far as these hours numbers, they've created benchmarks. So like if you're looking at your application from volunteer work or clinical experience, if you meet these benchmarks, you can confidently say, I have a pretty strong application when it comes to volunteer work or clinical experience. So before I give you those numbers, though, I want you to take them with a grain of salt, because I tell my students, I would rather have you have less hours and a more impactful experience. But these are some guideposts. So they're just guideposts, guys, okay? And not all students kind of meet the benchmark in every single category. So there's not enough minutes in the day to do that. So for volunteer work, community service, a rough estimate is around 200 hours. For leadership, we expect 3 leadership positions, each position lasting at least 3 months. Research, roughly a year working in some sort of research environment. Shadowing, around 50 hours, a couple days shadowing in 3 different specialties. So it's important that you get that different specialties. You don't just dump all of your hours into one category. And finally, again, with clinical experience, much like community service, 200 hours. Now, you might find yourself going, wow, there's not much shadowing there. That's right, because there's not a lot to translate onto your application from shadowing, because it's such a fly on the wall experience. You need to do some so you know what you're getting yourself into, but it's not a huge part of your hours investment. Take it away, Dr.
Yep.
Z.
Thank you. And then in terms of finding these experiences, the first thing I'll say is it takes quite a bit of work, basically. I mean, it's not that easy. And if you're at the undergrad level, I think there's a few ways that you can find these experiences. Number one, which I kind of referenced before, is, you should work and meet with your pre-med advisor, however you might feel about him or her, basically. Quite often, they are a great resource in terms of local types of opportunities, for example, like how to volunteer at the hospital, how to get maybe a shadowing experience, community service, research, because sometimes there's even protocols for how undergrads or pre-meds need to enroll in this kind of stuff. So at the very least, one of the things I've learned in my much older age is it never hurts to ask. The worst thing they can say is, I don't know. Okay, you've learned something and you move on, basically. So that's number one. Number two, I think it's really great if you have the opportunity to join a pre-med organization on campus, basically. AMSA has chapters, HOSA has chapters, there's Alpha Epsilon Delta, basically. There's a lot of different kinds of healthcare oriented organizations out there. Sometimes there's more than one on campus. So you need to see, you know, what their mission statement is, see if you're interested in it. But the reason I mentioned that is often they're a great resource in terms of finding these opportunities, especially if there are upperclassmen there, basically. They've gone through it. So why reinvent the wheel? Just ask them, what do I do, basically? So I think that's a great way to go with that, basically. And then the third thing is, you know, connections in life matter. That's also something I learned at a much older age, basically. But if you have good, you know, family, friends, especially if they are in the healthcare field, you know, ask them, like, you know, I'm looking for this kind of opportunity. What's out there, basically? You know, when people know that you have a connection, they're much more likely to help you, basically. And then the fourth thing, actually, this is something I actually learned from one of my pre-med coaching clients, is some universities, like for example, at University of Texas, they have a website called Eureka. And on that website, they list all the research opportunities available for students, basically. It's just like a gold mine, basically. So it lists all the names of the projects, who the PI is, what they're looking for in an applicant, how to contact them. So definitely look and see if your university has something like that. That'll save you a lot of time, basically. So those are some of my tips.
Got it. So similar question about, hey, how do I go about this? But we've had dozens of these questions, of the 130 that are currently sitting in queue, tied to letters of recommendation. I know that you covered this on some of the slides, but if you could go into a little bit more specific detail in regards to providing advice on how do I go about getting these letters of recommendation? I mean, you told me how many I needed, but how do I actually go about getting them?
Yeah. So in terms of going about to get them, we talked about the types that you need. Basically, you sort of have to do an assessment. You know, number one, like I said, you have to, the sort of overriding criterion, I think, in terms of looking for letters is the quality, basically, right? You know, it's like a bell curve. You don't want to be in the middle of the bell curve. You kind of want to be towards one end. So you sort of have to do sort of a self-assessment for whatever experience or class you're in, to think, you know, will I be able to get a strong letter of recommendation from this individual, basically? And second of all, do you think this individual will be reliable in terms of actually writing it and turning it in on time? That seems like sort of an odd thing to add, but believe me, that's one of the biggest sort of crises I deal with my clients, is like, oh my gosh, I've reached out to my letter writer 100 times and I haven't heard, not literally 100, but a lot, and I haven't heard back yet. So, you know, you want to try to find someone who's reliable also. But once you've identified the individual, whether it's a science professor, whether it's a PI, whether it's a supervisor for an extracurricular, these are the steps I think you need to do. This is at least what I recommend for my clients, basically. Number one, like I said before, you want to send an outreach message to them, probably through email. And like I said before, in that letter, you should literally write, would you, you know, explain, you know, why you're reaching out to them, explain that you're pre-med, that you need a letter of recommendation, and literally write in there, would you feel comfortable writing me a strong letter of recommendation? And I also think in the body of the message, you should offer to meet with them in person or virtually, whatever is the most convenient way. You know, this is a big ask on your part, and you need to show that you're willing to dedicate the time and effort to make this happen, because they might want to ask you questions. They might want to hear from you themselves about why you're asking them. Whatever it is they want to ask, you should be willing to do. And then, of course, whatever materials that they want from you, you should be willing to send. You know, usually it's a resume. They might ask for a personal statement. Sometimes that's hard because the individual hasn't written the personal statement yet. So that's something you need to discuss with them. So that's part two. Once somebody has agreed to write you a letter of recommendation, the one piece of advice that I give my clients is to create what I call a one-page refresher document for that individual. And on that document, you want to write the nature of your interaction. You want to write, you know, if it's for a class, you know, what kind of good grades you got, what kind of distinctions you got, all of the things that are kind of like the positives about yourself. If it's for a job or a research, you want to write down, you know, what your main responsibilities were, what your presentations, publications were. The main thing is you're trying to provide very granular, detailed content for them that they can then potentially just utilize and dump into their letter. Because I don't like depending on other people to remember all the great things I did, because they have a million and one things that they already have to remember already, basically. So you have to remember to make the process as turnkey as possible for each person who agrees to write you a letter. And I would also recommend that, the other question is, when do I have to get the letter in by? So the soonest that you can usually do it is sometime in May, because that's when you can create an MCAS account. You have to give them a special form to fill out. You can still submit the MCAS application without the letters of recommendation, but I think it's nice to get everything in a timely manner. So definitely tell them to get it in by May at the latest, because usually it takes longer than that. So that's my advice.
So we have about 9 minutes left. I'm going to see if we can get through 3 to 5 questions. So we're going to do quick answers, and then more detail can come through email if people need more help. So let me just read through a handful that I picked out. We had one person say, what are some tips for non-traditional applicants? And then someone said, I have the same question. And then somebody said, me too. So I'm feeling like there are many non-traditional applicants who are on this webinar. I know you could do it a complete hour specifically towards non-traditional, but if you could come up with like 2 or 3 hot tips for non-traditionals as a whole when they're applying, what are like the top 2 or 3 things that you could think of, either you or Dr. Nelson?
Yeah, I would say, take advantage and capitalize on being a non-traditional applicant. I mean, that's what sets you apart. I mean, you have to have, the prereqs and everything that get you, to the holistic evaluation phase of your application. So you have to check the boxes to get to the door, but then fly the flag of being a non-traditional applicant.
Exactly.
Okay. All right, so we'll leave it at that. Again, we can give you much more information on that if you talk to one of our enrollment advisors in person, but I think at a high level, that's a good spot. Let me throw one more question. A lot of people have asked, what is the right time to seek admissions advising support? I mean, the application's open in one part of the year, but you have a whole year. When should you really start getting help if you need help?
Tomorrow.
Now. Is that what you said?
Now.
Now. That's what I was going to say.
But if you could answer in a little bit more detail, are there different parts of the application that you're getting help with in different parts of the year?
Absolutely. I mean, ideally, you'd get engaged with us as soon as possible so we can kind of help you build these things going forward. But let's say you're in your application cycle time. Again, the earlier the better, because, let's say we've opened up our application packages for the 24-25 cycle already. So we're working with these students, not as much so much on creating their personal statement, activities document, and so forth. We're kind of guiding them how to maximize these last few months as far as balancing your activities and so forth. The applications are time sensitive, meaning the earlier you apply, the better your chances. So, the application due date is kind of irrelevant. It's the first day of the portal opening that you can submit is really the due date. The due date is like months later and you're out of the game by then. So engage with us several months before that due date so we can get high quality written documents done for you.
Yeah, exactly. This is the time, like I've just started, I've started working with some clients now who are applying next year. And one of the biggest added values of what we're doing is assessing their candidacy and seeing the things that they can do to improve it now. And they still have time to do it versus like if you seek advice, a month or 2 before, that's kind of a little bit too late. So that kind of timing really makes a big difference because you can make a bigger impact, of course, the earlier that you start seeking the advice.
But being cognizant of finances as well, we can work with you a la carte as well. Let's say you've applied and you're at interview phase and you've got several interview invites. You can connect with us for just interview prep or just secondary application, help. So there are many different ways to engage with this company.
So because we have a couple minutes left, I'm just going to jump in at random on the Q&A now so we can see if we can fly through a few more. One question that showed up, what undergraduate majors are best for pre-med students?
Oh, I love this question. So the answer is, it doesn't matter. Because often people think, I have to major in some kind of science, biology. Yes, statistically speaking, most of the applicants do that. But I always say the main criterion for picking your major is that you're passionate about it. So if you're a theater major, English, whatever, that is perfectly fine. There's a lot of advantages to do. College is the time to try different things, and the major is no different in that aspect, basically. So major in whatever you love, minor in whatever you love, get a certificate in whatever you love.
let's see. Will it hurt my application if I attended a community college, and what can I do about that?
I would try to take as many of the core prerequisites at a university level as you can. So if you started out at a community college, that's fine if you're doing some gen ed courses and so forth, but retake or try to take as many of those core prereqs at the university level.
Okay, let's see. We're going to try one more question. I'm going to try to find one more good one if I can find it. Well, I don't know if this is the best question, but it's one I have written down, so we're going to go with it. What are some tips that you could share on the way you can tell your story when describing your extracurriculars?
Well, I think it depends where you're describing it. If you're describing it in your work activity section, I think that's a much more black and white approach, where I think you should talk about, why you joined the extracurricular activity, what your main responsibilities were, again, the results you got from it, and what you learned from it. That's the 4 components that I would include. There might be some more, but those are the 4 main ones. But if you're writing about your extracurriculars in terms of for your personal statement, at least the way I work with my clients, I do it in a different way, where I have them think about the quality or skill about themselves that they want to market to the admissions committee, and then think about an experience that's going to help illustrate it. And then you write, and then you sort of focus on the details that help illustrate that quality. So that's going to come out differently because there's a much more different focus on that. And that's kind of more of a story type form, basically. So I don't know what Dr. Nelson does, but that's sort of the perspective that I utilize.
I agree with the Go ahead.
I was going to say, in the 2 minutes we have left, Dr. Nelson, give me the one hot tip that you haven't had a chance to talk about yet.
Make your application and your experiences not about what you think the admissions committees want to see, but what you're passionate about and what resonates with you. For example, I worked with a student. He was struggling, to figure out, what can I get involved in that, really tells something in the admissions committee about me. I'm like, well, tell me about your family. Tell me about your life. Well, my sister is legally blind. I said, okay, great. So he started raising puppies for the first year that become sight dogs for blind people. And he got into 8 medical schools last year.
Impressive.
Ziggy, what hot tip do you have that you haven't had an opportunity to convey yet?
Yes, my hot tip is going to sound a little idiosyncratic since we've been giving you all these tips about what to do. My tip is, don't forget to schedule regular breaks for yourself, because the process of applying is a marathon. And if you really don't look out for your mental health, your physical health, you're gonna fall short of the finish line, basically. So really, in all seriousness, make sure you take time for yourself every week. Do something you enjoy, fresh air, take a walk, whatever it is. It's going to make a big difference.
So I guess that's a wrap. I want to thank you guys so much for putting this on, and for all of the attendees on this webinar. Again, if you're ready for admissions advising help with a personal physician that can be on your side and help you get into med school, we have the QR code right here. If you have any questions, email me directly at brett@medschoolcoach.com. They're already starting to come in, but I will answer them all by tomorrow, I promise. And otherwise, that's a wrap for tonight. So thank you guys so much for joining, and I hope you learned a little something, and I hope you all get accepted into medical school.
Yay.